Hello everyone, I'm Dr. Asad Tahir, and I'm happy to be your teacher. Before we get started, let me tell you a little bit about myself. I am a fellow of the College of Physicians and Surgeons Pakistan, specializing in operative dentistry and endodontics. I've dedicated over 10 years to assisting individuals with their smiles and oral health. It has been an incredible journey, and I am eager to share my knowledge and experience with all of you. Now, let's discuss what we'll be covering in today's lecture. We'll start with Topic 1, focusing on behavioral management strategies for pediatric dental patients. We'll explore effective techniques to ensure positive experiences for our young patients during their dental visits. Next, we'll delve into Topic 2, where we'll address pain and anxiety management of pediatric patients. We'll examine both non-pharmacological and pharmacological methods to alleviate discomfort and fear in children during dental procedures. Finally, we'll conclude with Topic 3, which revolves around local anesthesia and conscious sedation techniques. We'll discuss the importance of these techniques in ensuring comfort and safety for our pediatric patients during dental treatments. To discuss children's behavior during dental procedures, and we'll explore how we can categorize their behavior into 4 main groups. First, we have the cooperative group. These are children who are willing and able to cooperate during dental procedures. They typically follow instructions well and are comfortable with the process. Next, we have the potentially cooperative group. These children may manage a simple examination but might struggle with more complex procedures, especially if they're carried out too early in the treatment plan. They might need a bit more support and reassurance to feel comfortable. Then, we have the group categorized as lacking cooperative ability, or pre-cooperative. These are very young children with whom communication might not yet be possible. However, cooperation may be achievable as they mature. It's important to be patient and understanding with these children as they grow and develop. Lastly, we have the uncooperative group. These are children who are too anxious to cope with any procedure. This group also includes children with specific disabilities that might make dental procedures more challenging for them. In these cases, we need to approach treatment with extra care and sensitivity to ensure their comfort and safety.
Now, let's talk about the treatment approaches for different categories of children based on their behavior. For cooperative and potentially cooperative children, treatment planning involves thoughtful consideration and good behavior management techniques. These children are generally willing to cooperate but may struggle with more complex procedures. For example, a child might be perfectly fine with getting fissure sealants, but may become upset when faced with the prospect of a tooth extraction. In such cases, it's important to approach treatment with sensitivity and patience, providing reassurance and positive reinforcement throughout the procedure. On the other hand, for precooperative and uncooperative children, a different approach is needed due to their lack of communication or excessive anxiety. Conscious sedation or general anesthesia may be considered to help manage their anxiety and facilitate the necessary dental procedures. This approach is particularly important for very young children or those with specific disabilities who may find it challenging to cooperate during dental treatments. By understanding the individual needs and behaviors of our patients, we can tailor our treatment approaches to ensure a positive and successful dental experience for everyone involved. To discuss an important aspect of dental care, helping anxious patients cope with their dental experience. Dental anxiety is a common issue that many patients face, and it can have various contributing factors. Understanding and addressing patient anxiety is crucial for delivering effective dental care. Firstly, let's start understanding anxiety. Anxiety can stem from various sources, such as uncertainty about procedures, past negative experiences, or learned responses. It's important for us, as dental professionals, to listen carefully to our patients' concerns, especially when it comes to children. By understanding fears and worries, we can take steps to reduce their anxiety and create a more positive dental experience. Next, we'll discuss preventive measures. One effective way to mitigate anxiety is by establishing preventive programs that aim to maintain oral health and minimize the need for treatment. Building a trusting relationship with patients is key, as is addressing any specific worries they may have about their dental care. Additionally, ensuring pain-free treatment through proper anesthesia techniques is vital in alleviating anxiety and promoting a positive experience for our patients. In summary, by understanding the root causes of dental anxiety and employing strategies and techniques, we can help our patients cope with their fears and ensure they have a comfortable and positive dental experience. Let's explore some effective techniques to reduce anxiety in patients undergoing dental procedures. Reducing uncertainty. One technique is the tell-show-do method, where the dentist explains, demonstrates, and then performs the procedure while providing praise. Providing detailed information to parents can also help uncertainty, although its effectiveness varies. Acclimatization programs, while beneficial, can be time-consuming. Modeling. Using observations of positive dental experiences can help alleviate anxiety. This can involve showing live models or videos of cooperative patients. It's important to the model's age to the patients and highlight the dentist's caring nature. Cognitive approaches. Addressing negative thoughts and beliefs associated with dental treatment is crucial. Techniques include identifying negative thoughts, suggesting positive alternatives, and working with therapists for deep-seated beliefs. Distraction techniques can also help shift focus away from dental procedures. Relaxation. Teaching patients relaxation techniques can reduce tension. This can be combined with biofeedback training, although it requires trained therapists. Systematic desensitization. Gradual exposure to feared stimuli can help reduce anxiety levels. This technique requires trained therapists and can be preceded by dentally based acclimatization programs. Hand-over-mouth exercise, home. This method involves physical restraint and is controversial, particularly in the UK. Some suggest its use with inhalation sedation as an alternative to general anesthesia, but cultural considerations must be acknowledged. By employing these techniques, we can create a more comfortable and positive experience for our patients undergoing dental procedures. Pharmacological pain and anxiety control in pediatric dentistry. Pain and anxiety are natural responses that often intertwine, especially in the dental setting. Managing child dental anxiety is crucial and is best achieved through a combination of preventive measures, good behavior management, pain-free operative care, and individualized treatment planning. First, let's talk about the child perception of pain. It's important to understand that a child's perception of pain is subjective and varies widely, particularly with age. Infants up to about 2 years old are unable to distinguish between pressure and pain. However, as children get older, they start understanding what hurt means and can differentiate it from mere pressure. Identifying children who are amenable to explanation and cooperation with local anesthesia, LA, can be challenging, as not all children respond in the same way. Children over 10 years old are more likely to actively participate in decisions regarding LA, sedation, or general anesthesia, GA. Teenagers, on the other hand, resemble adults more closely, which influences their choices regarding pain control methods. Moving on to the role of pharmacological pain and anxiety control, we'll specifically explore the roles of conscious sedation and general anesthesia, GA, as adjuncts to behavior management. These pharmacological interventions play a crucial role in ensuring the comfort and well-being of pediatric patients during dental procedures. By understanding the nuances of child perception of pain and the options available for pharmacological pain and anxiety control, we can better tailor our approach to each individual patient, ensuring a positive and comfortable experience for them. Some important factors that influence a child's response to pain control methods in pediatric dentistry. Firstly, coping ability, family values, general anxiety level, and intelligence all play significant roles in determining how a child responds to pain control methods. These factors can vary greatly from one child to another and can influence their comfort level during dental procedures. Teenagers, in particular, may assertively express their preferences for or against specific pain control approaches. It's important to listen to their input and consider their preferences when planning treatment. Next, let's talk about the relationship between pain and anxiety. There's a strong connection between the perception of pain and the degree of perceived anxiety. Painful procedures can induce fear and anxiety, while fear and anxiety can intensify pain. Managing this cause and effect relationship is central to effective patient management. Effective behavior management techniques can help reduce anxiety, subsequently lowering the perceived intensity of pain experienced by the child during dental procedures. In conclusion, understanding a child's evolving perception of pain, considering individual factors influencing responses, and recognizing the intricate interplay between pain and anxiety are crucial in implementing effective pharmacological pain and anxiety control in pediatric dentistry. By taking a comprehensive approach that addresses these factors, we can ensure a more positive and comfortable experience for the child during dental procedures.